So first up, association between vitamin D deficiency and residual dizziness in idiopathic BPPV, which stands for benign positional paroxysmal vertigo. Basically, it's one of the nice or happy forms of vertigo, one of the not scary ones. It's the not scary, one of the big not scary vertigos. And what they wanted to do is they wanted to see if post gold standard treatment, which is going to be a canalith repositioning maneuver, because the thought process is that with BPPV, you have these little otoliths, these little crystals in your ear that act as a buoy that essentially helps figure out between your eyes, your neck, and everything else where you're at in three-dimensional space. That just helps figure things out, like, okay, my eyes are parallel to the horizon, my neck is telling me that my head is oriented more or less correctly, and then the input I'm getting from my ears, whether I am moving or standing still, comes from two different components. If I'm standing still, it's think of it, the body of the inner ear, the utricle and saccule. As soon as I start to turn, twist, like rotate my head to the left, or I start walking fast, it goes into the semicircular canals because I'm having some displacement there. So after that quick little review, what happens is after this canalith repositioning maneuver, which is oftentimes called Epley's repositioning maneuver, while it does work a majority of the time, you can get some residual dizziness for a while afterward. So they wanted to see if it was maybe something like a vitamin D deficiency that can really peel out who's going to have this residual dizziness, as well as if it can be something addressed and fixed. Now, what they did is they took that subgroup that they categorized as deficient or insufficient, and they received 12 weeks of vitamin D3 supplementation, and they wanted to see, all right, what was the result? Well, it's pretty cool, actually. Vitamin D did seem to help. So a moderate positive correlation emerged between serum vitamin D and disability scores. And there was significant increase in vitamin D levels before and after treatment in the treatment group, so it actually worked. Both groups showed significant shortening of the measured impulse wave latency after 3 months, so that they're improving and they shouldn't have residual dizziness, but only the treatment group showed significant reduction in a different parameter, latency, and their disability scores, which were reduced by 48.2%. They confirmed in this study that vitamin D enhances otolith function and neural integrity, especially in those patients suffering with the residual dizziness with idiopathic benign paroxysmal positional vertigo.